I'm going to be discussing the St. Jude ICD case. The ICDs manufactured by St. Jude Medical are implantable cardiac defibrillators that were implanted into patients with heart irregularities or patients who regularly experienced heart arrhythmias. And these devices were intended to shock the heart of the patient whenever it detected an irregular heartbeat without them having to go to the hospital or to the doctor's office whenever they experienced heart complications. And the new ICD design that St. Jude was producing in this production started in 2010 had a new lithium ion battery, and this lithium ion battery allowed the device to recharge itself so that every time it delivered a shock, it could recharge and then deliver another shock whenever they had another heartbeat irregularity, which allowed the device to be implanted in the patient for several years, which also allowed them to not have to go through as many surgeries to change out the devices every time they delivered a shock and were depleted of the battery. So they started implanting these devices in February of 2010. And just a couple months after they started implanting these devices, they were receiving reports from patients who were experiencing irregular shocks or not receiving shocks at all. And their doctors informed them that their ICD batteries were completely depleted. So around 2012, the engineers at St. Jude decided to investigate this case and to investigate the battery failure, and were also tipped off by the battery suppliers that the lithium ion batteries could be failing. However, even after receiving this information, they concluded that there was no solid evidence that the ICDs were failing and continued manufacturing them for 3 more years. However, the FDA eventually recalled the device in 2015 and indeed concluded that the batteries were the problem. However, the executives at St. Jude continued to sell the devices even after the recall, and they sold them for 17 more months after the recall, and then eventually had to settle 2 lawsuits surrounding patient deaths that were related to the ICD failures. The most morally significant decision made by the engineers in this engineering disaster case was the decision to not continue the battery failure investigation when it was first brought up in 2012. And I think this is the most significant decision made in terms of morality, because this was the instant in which the engineers were made aware that their product could potentially kill people. And up until this point, they were manufacturing and producing this, and they didn't know that there was anything wrong with it. And it was a new technology, so there was no one to really say that it could or couldn't kill anyone. But when they got this definite proof and continued to produce it was when the questions of morality can be raised. And I think that the values of reputation and expectation were the two values that were most primarily driving the decisions made by the engineers, because they worked for such a large company in the field of medicine, and they felt the need to perform because at any point they could be replaced and their jobs and like the welfare of their family and their career could be on the line, which was probably a very, very stressful situation. Moving into the value analysis part of this presentation, it's actually important to define the term better before I start to suggest what I think would have been better decisions or better values to have been held by the engineers. And in the context of this presentation, the term better means the decision or the action that would have saved the most lives. So in my opinion, that would have been the best decision in this case, would have been the decision that would have saved the most lives. So with that being said, if I were in this position, I would have suggested that when the engineers were initially made aware that the batteries were faulty in 2012, that they should have stood their ground and conducted the entire battery failure investigation, even with pressures from St. Jude Medical and the executives to continue producing the product in order to make a profit. I think if they would have stopped right at this moment and completely evaluated all of the different components of the device and fully investigated what could have been the cause, they would have found that the battery failure was the cause. And I think that it would have saved them not only the lives that were lost ultimately at the end of this whole case, but also a lot of time and a lot of their resources. They continued to produce faulty devices for 3 years after they discovered that they were faulty, which ultimately cost the company a lot of money as well. So overall, if they would have decided to investigate the battery when it was first brought up to them that the battery could have been a problem, I think they could have avoided both the loss of life and the loss of reputation for their company. And if the engineers would have acted with integrity, safety, and innovation in mind, I think these values would have driven them to make this decision in the end. And it's often the case that engineers actually do prioritize integrity and safety at first. And it's only when these values seem to conflict with the values previously held by the engineers, in this case, reputation and expectation, that the problems arise. So the engineers, when they were designing this, ultimately did have the safety of the patients in mind. They wanted the patients to be able to have less extensive surgeries to replace the devices. They wanted the device to last longer, and they were ultimately trying to provide them with a better quality of life. However, they ultimately decided to put this behind their own reputations when they continued implanting devices that they knew were faulty, and this is what led to the whole disaster. Additionally, I think integrity is a really important value that the engineers should have had, because honesty a lot of times is something that's valued by society as a whole. And I think that if the engineers would have acted and stood their ground with integrity, then there was no way that they could have been in trouble, even if the devices still were faulty. Because most people in this society value integrity, honesty, and human life very highly. So if they would have acted to preserve this, then there's really no other way that they could have been accused of doing anything immoral. And from all of this, the main moral takeaway is that authority does not really translate to morality. So while the engineers may not have been in the highest standing in the company, they were the most equipped to make the decisions to preserve the human lives that were lost at the end of this case.